Hi there and welcome back. Let's review descending thoracic aortic aneurysm in this session. We'll address the conceptual understanding, causes, symptoms, diagnosis, treatment, and bottom line, how do we underwrite. Descending thoracic aortic aneurysms are the third most common type of aortic aneurysm. The majority of patients are diagnosed in their 6th and 7th decade of life. Most patients are without symptoms for a long period of time until the thoracic aortic aneurysm is very advanced or found incidentally on a chest X-ray, CT scan or MRI. The descending thoracic aorta is located in the posterior thorax, back part of your chest cavity. As the aortic arc curves from the front portion of the thorax towards the back, the descending thoracic aorta continues down the posterior portion of the chest cavity. The anatomical boundaries of the descending thoracic aorta are the left subclavian artery and the celiac artery. This is the first major artery in the abdominal cavity. The location of the descending aorta provides some idea about the symptoms one may experience if there is a problem with this portion of the thoracic aorta. So with that, what are the causes? Atherosclerosis, aortic dissection, penetrating ulcer, infection, and connective tissue disorders are the common causes noted. How about symptoms? The presentation for the majority of descending aortic diseases is back pain or vague chest pain. Other symptoms include difficulty swallowing, hoarseness, and difficulty breathing, compression on the lung airway, and cough. Those are the typical symptoms. Diagnosis. The plain chest X-ray is not a common diagnostic tool to identify problems with the descending thoracic aorta. However, it is a study that commonly discovers these aneurysms accidentally. The chest X-ray may show that the heart shadow is widened and an exaggeration of the aortic contour. The gold standard test to diagnose descending thoracic aortic problems has become the CT scan angiogram and MR angiogram. A transesophageal echocardiogram can provide the appropriate or the approximate size of the aorta in the presence of a dissection and other abnormalities. How are we treating descending thoracic aortic aneurysm? A majority of descending thoracic aorta diseases can be treated conservatively. When we speak of conservative management, this refers to blood pressure control, smoking cessation, cholesterol control, aerobic exercise, and avoiding heavy weight lifting. However, symptoms related to a descending aortic aneurysm or dissection should be taken seriously. Back pain, chest pain, change in voice character, shortness of breath, coughing up bloody mucus or secretions are to be considered seriously. The gold standard for repair of descending aortic aneurysms is open surgical repair. However, certain diseases of the descending thoracic aorta lend themselves to endovascular therapies. In addition, patients who are old and frail and with many medical problems, specifically severe heart and lung problems, will do better with endovascular stenting of the descending aorta. However, many factors are to be considered prior to making any recommendations for either approach. So bottom line, how do we underwrite? Follow your company specifics and the underwriting manual that your company expects you to follow. Okay, let's take a quick break and see you soon. Take care. Bye now.